Have you ever found yourself wondering quietly, maybe late at night, is it really okay that I still do this every day? Not out of guilt, not out of shame, but simply because the question lingers. If that thought has crossed your mind, you're not alone. Thousands of men over 60 think about this in silence. We talk openly about blood pressure, cholesterol, and even testosterone. But when the subject shifts to self-touch, suddenly the room goes quiet. There's hesitation, embarrassment, and often a lot of confusion. That ends today. On Senior Health Booster, we ask the questions that matter, without judgment, just truth. So let's tackle it directly. What really happens to your prostate if you masturbate daily after 60? For decades, men have been told all sorts of things about masturbation. Some myths say it drains your energy, others warn it inflames the prostate, and some even whisper it could trigger cancer. The problem? Most of these ideas aren't based on science, they're based on fear. And fear is dangerous because it stops men from asking the right questions. It makes us doubt our biology and, worse, avoid things that might actually help us. The good news is we no longer need to rely on myths. We have decades of medical research to guide us, and the findings may surprise you. Let's look at what real science says. In 2016, researchers at Harvard University published a landmark study in JAMA Oncology. They tracked over 31,900 men for more than 18 years. These weren't teenagers, they were men in midlife and beyond. And what did they find? Men who ejaculated more often had significantly lower rates of prostate cancer. To be exact, those who ejaculated 21 times per month or more had a 33% lower risk of prostate cancer compared to men who ejaculated just 4 to 7 times per month. That's not a casual observation. This was peer-reviewed, controlled for age, lifestyle, and medical history. No agenda, no product to sell, just hard data. And the data told a very clear story. Regular ejaculation is linked to healthier prostates. But why? Why would daily or frequent ejaculation actually protect your prostate instead of harming it? Here are 3 reasons your urologist, like Dr. Noelia Carvian, might explain in plain language. Reason number 1. Clearing the pipes. The prostate produces seminal fluid. When ejaculation doesn't happen often, secretions can build up inside the gland. This stagnant fluid may increase oxidative stress and trigger low-grade inflammation. Picture a garden hose left unused. When water sits too long, bacteria and debris collect. Ejaculation clears it out, keeping the system flowing. Reason number 2. Lowering inflammation. Frequent ejaculation helps reduce congestion in the prostate, supporting circulation and lowering the risk of chronic inflammation, a known contributor to prostate problems. Reason number 3. Supporting hormonal balance. Ejaculation can play a role in regulating testosterone and other hormones that influence prostate tissue health, especially as men age. So instead of draining your vitality, as old myths suggested, healthy sexual release may actually be protecting your prostate and your long-term well-being. The bottom line? Daily masturbation after 60 isn't something to feel conflicted about. In many cases, it could be one of the simplest, most natural ways to support prostate health. And that's not myth, that's medical science. Now, let's go deeper into the science. We already talked about how ejaculation helps clear the pipes, but there are more reasons why regular release can actually support your prostate and overall health. Reducing inflammation and stress hormones. When ejaculation happens in a relaxed, natural state, it can lower cortisol, the body's main stress hormone. That's important at any age, but especially after 60, when chronic stress has a bigger impact. Elevated cortisol is linked to persistent inflammation, higher blood pressure, and even a weakened immune response. Research published in PubMed and the National Institutes of Health shows that balanced sexual activity is associated with lower systemic inflammation. For men dealing with enlarged prostate, BPH, this matters even more because inflammation is a key driver of those uncomfortable urinary symptoms, supporting circulation and pelvic nerve health. Just like muscles need regular activity to stay strong, your reproductive system thrives on healthy use. Ejaculation promotes blood flow in the pelvic region, keeping nerves responsive and tissues oxygenated. As we age, circulation naturally slows down, which can affect not only function but also long-term tissue health. Regular, natural release helps counteract that decline. It's not about hyperactivity or pushing limits. It's simply about maintaining the mechanics your body was designed to use. But here's the truth: frequency isn't the only factor. Context matters. In the Harvard study, men who had healthier ejaculation patterns weren't just focusing on release. They also tended to sleep well, exercise regularly, manage stress, and maintain a balanced weight. In other words, masturbation was part of a bigger picture of overall wellness, not an isolated habit. That raises another common question: can you do this too much? The answer is both yes and no. If it's driven by compulsion, stress, boredom, or anxiety, your body will give you warning signs. You might feel drained, restless, or unsatisfied afterward. In that case, it's no longer serving your health. It's acting as a stress outlet. But when it's part of a calm, grounded routine where you feel relaxed, balanced, and clear afterward, then it's aligned with your biology. This isn't a contest, and it's not about hitting a number. The real key is tuning into your body. If you're over 65 and wondering whether this still applies, the answer is absolutely yes. The research we've discussed includes men well into their 70s. Aging doesn't erase biology. It just makes mindful care even more important. The difference is in the approach: gentler, slower, less rushed, and more attuned to your natural rhythm. At its core, release isn't only about pleasure, it's about maintenance. Your prostate actually thanks you for supporting its function. That said, masturbation alone isn't the full picture. It's one tool, one piece of the larger system of habits that keep your prostate and overall health strong after 60. Daily choices, your diet, movement, sleep, and stress management work together with sexual health to shape your long-term well-being. And when you understand that, the silence and confusion around this subject finally break. Because the truth is simple: after 60, staying connected to your biology is one of the best gifts you can give your prostate and yourself. Now, let's pause and take a wider look. Because here's the truth: if you're releasing regularly but your daily habits are fueling inflammation, skipping exercise, or robbing you of quality sleep, it won't be enough. Ejaculation is powerful, yes, but it's only one piece of the bigger prostate health puzzle. So, what else does the science say about protecting your prostate as you age? Let's break it down into 5 key areas every man over 60 should know. Nutrition that calms the prostate. The prostate is highly sensitive to diet. One nutrient stands out above the rest: lycopene. This antioxidant, found in tomatoes, watermelon, and pink grapefruit, gives red fruits their color, but more importantly, it helps reduce oxidative stress inside prostate tissue. A large study published in Cancer Epidemiology, Biomarkers and Prevention found that men with the highest intake of lycopene had a significantly lower risk of developing aggressive prostate cancer. And here's the catch: it works best when consumed consistently. A few servings of cooked tomatoes, tomato paste, or watermelon each week can make a measurable difference. Other foods that support prostate health? Green tea, rich in EGCG, a natural anti-inflammatory compound. Cold water fish like salmon and sardines, packed with omega-3 fatty acids that fight inflammation. And cruciferous vegetables, broccoli, cauliflower, cabbage, that help detoxify excess hormones. The bottom line: what you eat shapes your prostate just as much as what you do with your body. Daily movement for circulation. Circulation is life. When you sit too long, especially with poor posture, blood flow to the pelvis slows down dramatically. That stagnation increases pressure and swelling in the prostate and urinary tract. But here's the good news: you don't need marathons to fix it. Simple walking, light stretching, even 10 minutes of pelvic floor work makes a big difference. Kegel-style exercises, where you squeeze and hold the pelvic muscles, have been shown to improve urinary control and sexual function in men. And with improved circulation comes healthier ejaculation, better tissue oxygenation, and stronger pelvic nerves. Hormone balance through quality sleep. Sleep isn't just rest, it's repair. Testosterone, the hormone tied to vitality, energy, and prostate health, peaks during deep sleep. Without good sleep, testosterone drops, abdominal fat increases, estrogen rises, and inflammation creeps higher. That combination is a recipe for prostate discomfort. Protecting your sleep is protecting your prostate. Cut screens at least 90 minutes before bed. Avoid caffeine in the afternoon. Keep your bedroom cool and dark, and try natural supports like magnesium glycinate or tart cherry juice. Small, consistent improvements in sleep can translate into real changes in prostate comfort within weeks. Tackling inflammation head-on. Inflammation is the silent enemy of aging men. Chronic prostatitis, inflammation of the prostate, affects millions and leads to pain, frequent urination, nighttime disruptions, and poor quality of life. The tricky part? Many men ignore low-level inflammation until it becomes a bigger issue. That's why nutrition, circulation, and stress management aren't optional. They're essential. Together, they form the natural anti-inflammatory shield your prostate needs to stay resilient. Putting it all together, daily release supports your biology. But combine it with the right foods, steady movement, deep restorative sleep, and inflammation control, and suddenly you're not just surviving after 60, you're thriving. And that's the bigger picture most men never hear. It's not about guilt or shame. It's not about numbers. It's about listening to your body and giving your prostate what it needs to stay healthy for decades to come. But here's something most men don't realize. Prostate inflammation isn't always about infection. In many cases, it's systemic, fueled by blood sugar spikes, processed foods, alcohol, smoking, and, of course, chronic stress. These silent triggers can keep your prostate irritated day after day without you even noticing. A 2021 review in Translational Andrology and Urology highlighted that anti-inflammatory diets and stress reduction often improved prostate symptoms more effectively than medication alone. And yes, regular, healthy ejaculation plays a supportive role in lowering inflammation, but only if the rest of your lifestyle supports healing. It's not one magic habit, it's how the pieces fit together. Let's talk about stress and shame, the parts no one likes to say out loud. Many men grew up being told masturbation was wrong, weak, or something they should have left behind in adolescence. That guilt doesn't just stay in your head, it affects your body. Chronic shame elevates cortisol, disrupts hormones, and weakens the immune system. If every release comes with a burden of guilt, your body absorbs that stress. Here's the truth, you're not broken. You're not doing anything wrong. This is a natural biological release, one that your prostate can actually benefit from. When practiced mindfully, without compulsion, guilt, or distraction, self-touch becomes part of your healing, not your stress. Take a breath, let go of the fear, and recognize that this is simply part of being human. Now, what about men managing health conditions like high blood pressure, diabetes, or prostate enlargement? Many wonder, is it still safe? In most cases, yes. There's no evidence that moderate ejaculation worsens chronic illnesses. In fact, by improving circulation, supporting nerve function, and stabilizing hormones, it may even help. The only caution, if you're on certain medications that affect blood flow or libido, or if you've had recent prostate surgery, always check with your physician first. As always, this video is here to inform, not replace medical advice. So let's recap. Masturbation isn't a shameful leftover from youth. It's a natural function that may help your prostate flush out harmful buildup, reduce inflammation, maintain blood flow, and even lower the long-term risk of prostate cancer. But remember, it's only one piece of the puzzle. Your nutrition, sleep, daily movement, mindset, and stress management all work together to protect your prostate after 60. And if this opened your eyes, don't stop here. On Senior Health Booster, we've created a follow-up video, Daily Habits That Protect the Prostate After Age 60. No taboos, no gimmicks, just 5 simple changes you can start today from the comfort of your own home. Click now to continue your journey toward lasting prostate health. You've earned it.